Hi, my name is Kota Banda. I work for the National Health Research Authority, a statutory body under the Ministry of Health in Zambia. And I work as a senior research capacity building and knowledge translation officer. So I do a lot of work with research and capacity building and also utilization of research and health information. I am also a new mom, and it is my journey to motherhood and the experience that I have had so far, which has given me the most appreciation for family planning. For one, I deal with a lot of research, and so I was already exposed to family planning. I knew about it, but not enough, and not with the appreciation that I have had. Going through my pregnancy to motherhood was challenging for me because there's a lot of things I was not prepared for psychologically, physically, emotionally, and those are some of the things that I have been learning now. And those are things that I think that women should be able to learn, young women should be able to know as they are growing. There are so many barriers to family planning, and I think some of which contributed to my experience. Despite the exposure that I have with my work, a lot of barriers related to religion, related to my culture that prevented me from having full knowledge of family planning. And I think they contributed to some of the experiences that I had. So in my community and in most parts of my country, there's still a lot of issues with even just discussing family planning, later on access to family planning. And I will start by speaking about some of the culture issues. You can hardly speak about sex. That is a taboo in most of the homes, in most of the cultures. And so as a young woman, when you're growing up, those are some of the discussions that you do not have. So later on, speaking about options that you would have with family planning in terms of what options you have, where you can access them, those are still a big challenge, coupled with even our health system, where we do have issues of attitude to women accessing certain family planning, especially women who are not married. That is still a big problem in most part of my community. And I think that as much as our cultures can prevent or can present with barriers, those could also be opportunities for us to do something about it. Coming to religion, I have grown up in an environment that is highly religious, and that has also had a big influence on family planning. I can speak personally, and I think women, a lot of women like me, would have similar experiences. But again, I think that religion is also an opportunity for us to use to be able to reach out. So speaking about our culture and having it being a barrier to family planning, I think that there is room for us to use the structures that we have in our culture, you know, starting with sensitization, starting with provision of information. Most cultures, most African cultures especially, they do have certain they do have certain groups like the women groups. If a woman is about to get married, you know, there are some classes or trainings or mentorship or counseling that we do have. And I think that those provide an opportunity for women to be talked to about a lot of things concerning their health. That includes family planning. I, for one, feel that from the experience that I had, that would have been a good opportunity for someone to speak to me about the options that I have, for someone to speak to me about preparing myself as a woman, but also as a young person who has big dreams and big careers, big career goals, and wants to do a lot with their life. And I think family planning discussion would have come in handy for me in such a setting. Also, in our religious settings, you know, we do have a lot of women groups, and those are opportunities that I think could be utilized a bit better or a bit more, and have open discussions that affect women's health and their well-being, women and children. And that is where I think family planning could be discussed a bit more. So coupled with, in addition to the cultural and the religious issues that we have, that I personally feel had an influence to the challenges that I had. Right now, as we are going through the COVID-19 pandemic, I think that it has had a really big influence or a big impact on family planning. So firstly, speaking as a demographer, you know, with most of the country or most of the countries embarking on a number of non-pharmaceutical interventions, such as staying at home orders, encouraging people to work from home. Those create opportunities for a lot of unplanned pregnancies, and that is creating a lot more demand for family planning. However, as much as a lot of demand is being created by the current situation that we are going through, I think that the access to the service itself is actually less now when the need is there than previously, because of so many reasons. Different personal reasons, yes, cultural reasons, yes, religious reasons, yes, but also people are scared. People are scared to go to the health facilities where they can access different services. Many women, and from my work, I have read through a lot of reports that talk about family planning. I have engaged with a lot of stakeholders, and in my community, most women use, those who are on family planning, those who are fortunate to have access to family planning, use injectables. And we know that those would require a woman to continue going for injectables after some time. And the current environment we are in, some people actually don't even think that those services are still being provided at the health facilities. And even though some may know that, people are scared to go out. People are scared because every day you are seeing someone dying, you're hearing of someone dying, and people just want to stay at home. So I think that the impact of COVID-19 on family planning and is quite great, and it will have a really big effect on fertility issues. And to me, family planning is not just about me as a woman. You know, it's about the life for me and my whole family, that is for my child or my children. And I think that it's tied to the quality of life that I want to give my family. And so for a woman like me, it really brings a lot of issues, because like I said in the beginning, trying to work on advancing my career, but if I'm in a position where I'm not able to access family planning, it puts me at a risk to have an unplanned pregnancy, and that derails some of my dreams. It derails some of the plans that I may have, but also it affects my health, because I may not be in a position physically or psychologically or emotionally to be able to carry a child. So to me, family planning is very important. To me, family planning means I'm thinking about my health, I'm thinking about my child's health, I'm thinking about my family's health, and not just health, just general health, but I am thinking about the quality of life that I want to provide for my family, that I want to provide for my children. So family planning is an opportunity for me. It's my right, and it's an opportunity for me to live the best life that I want for me and my family. Thank you for listening.